Hi, my name is Dr. Peter Smith. I'm the principal of Clifton Beach Medical and Surgical, and I'd like to take this opportunity today to talk to you about vasectomy. Vasectomy is a very common procedure for men today, and there's often a lot of misconceptions and misunderstandings about the procedure and what actually happens. So this video is really to talk to those men who are contemplating or about to have a vasectomy to help them through the journey and understand the procedure that we perform here at Clifton Medical and Surgical. First of all, it's very important to understand the anatomy of the male genitalia, because there's a lot of myths about how having a vasectomy might affect sexual function or ability to enjoy sex after the procedure, which is really totally unfounded. So if you look at the diagram I've got on the screen, you'll see that we've got the anatomy of the male genitalia, and it's important just to understand that the testes produce the sperm. They are then transported up this tube called the vas deferens, and very importantly, it's important to understand that the body stores about 2 to 3 months worth of sperm in this structure called the seminal vesicle, which is located here. So because of this, when you have the operation, you're not actually sterile from the word go. You have to wait 3 months approximately before you can do a sperm test to show that you don't have any viable sperm left in your semen. And so we stress this very strongly with all potential surgical candidates. The other important thing is that a lot of men think that their ejaculate will disappear after they have a vasectomy, but this is not true. Only about 1 or 2% of the ejaculate is actually made of the sperm or the swimmers. Most of the ejaculate is actually made by the prostate and the seminal vesicle. So all men will ejaculate normally, it's just that they won't have any sperm in the ejaculate, and they won't notice that difference. They'll also produce the normal amount of testosterone, still have normal sexual function and normal sexual drive. It's just that they won't have sperm travelling up the tube. During this procedure, we use an anaesthetic called a neurolept anaesthetic, which is like a twilight anaesthetic which keeps you sedated and pleasantly relaxed. We also use a long-acting local anaesthetic that lasts for about 4 to 6 hours, which helps with pain relief after the operation. With this operation, we ask people not to be taking aspirin, Nurofen, fish oils, turmeric, and some other herbal extracts may affect the bleeding potential prior to the operation. And please discuss these with your doctor when you're having your consultation. It's also very important that after the operation that no heavy physical exertional activity should occur for 10 to 14 days after the procedure, and indeed no immersing underwater for the same period of time. Usually after about 2 or 3 days post vasectomy, most men are able to do light duties, desk duties, supervision, but heavy physical exertion, as I said, should be delayed for at least 10 to 14 days. There's a couple of questions that men ask when coming in for a vasectomy. One is, can the procedure be reversed? And yes, the procedure can be reversed. However, there is some problems with a thing called sperm antibodies. So after a period of time, and it's usually about 5 years, the body produces antibodies to the sperm so it can be reabsorbed by the body. The consequences of that is that the sperm doesn't swim as well, and therefore fertility is reduced. Not because the tubes can't be physically rejoined, it's that the sperm can't swim as well. So we strongly suggest that men consider this as an irreversible procedure and not go into it thinking that they could get it reversed down the track because of that. There's also some myths in the popular media or on the internet about the link between prostate cancer and heart disease with vasectomy, and this is totally unfounded. Vasectomy procedures have been around for many years, In fact, I've been doing this procedure for about 25 years myself, and there's certainly no link with these conditions, so you can be reassured. The procedure itself, now it's important to realise that this is a keyhole procedure, so we put two tiny little nicks in the scrotum. The advantages of this is that the procedure will allow you to heal much quickly and with less bruising and swelling. The disadvantage of this procedure is that some guys are not suitable for this procedure. Some guys, because of previous surgery, because of previous trauma, or indeed because of their anatomy, we can't access the little tubes in a keyhole fashion. And if that's the case, then we have to opt for a more open procedure which has to be done in hospital, and we would refer you off if that was needed. So importantly, you must have a physical examination prior to the operation to make sure that you're a suitable candidate, and also indeed to make sure you're a suitable candidate to have any operation or any anaesthetic. So at the time of the operation, what will happen is that you will come in and have some pre-anaesthetic checks with blood pressure, etc. You'll be asked to undress and be put in a gown. Then prior to the operation starting, a little needle will be placed in the back of your hand to administer the anaesthetic, and then during the procedure we actually inject a small amount of long-acting local anaesthetic in the scrotal region to keep the area quite numb. We also allow for music to be played during the procedure, so requests are taken. So it takes approximately an hour and a half for the pre-operation, operation, post-operation to occur, and we have a recovery area which has an ambulance bay access, so the patient can actually leave via the back door through the ambulance bay into a waiting car and taken home. With all procedures, unfortunately, there are potential for possible complications. And I guess the two most important complications we see with vasectomy are bruising or bleeding and infection. Now, as I mentioned before, avoiding things that make you bleed like aspirin, Nurofen and those other agents should be taken into account. Also, we ask about previous bleeding problems that you might have had with other operations. But more importantly, the message is that it is a very vascular area. There's a lot of little blood vessels in the area, and we do cauterize them quite well. However, if you don't rest immediately post-procedure and go home, rest, put ice on the area, then you may get more bruising than we would like. Most men who go home, rest and put ice have very minimal bruising, and so we put that challenge out to them to rest because they will have a speedier recovery. Infection is also a concern with this procedure, and there are, because of where it is a sweaty area, and so there is a slight increase of infection. However, by doing three things, we've been able to really reduce the amount of infection risk significantly. One is to remove the hair from that area. Two is to wash with an antiseptic soap the day before the procedure and the day of the procedure, and we will provide that soap for you. You must leave the soap on for a period of 1 or 2 minutes to give it some contact time, making sure you get it into all the creases in the area and washing it off, so that the night before and the day of the procedure. And also we give an antibiotic the night before, the day of, and for a few days after the procedure. And we find that these three things significantly reduce the risk of infection, and we very rarely see infections if those guidelines are followed. There are also other complications that we see less significantly. One is cord congestion syndrome and also granuloma. This is where you can get an ache in the cord or a little lump in the cord after the procedure. In the early days when we did this procedure, we used to tie the bottom ends of the cord, and this led to more incidents of this particular problem. In the last 20 odd years that I've been doing this procedure, we have not tied the bottom ends, and we seem to find that this is less of a problem. Usually most of these can be solved with a simple use of some non-steroidal anti-inflammatory agent after the procedure if this occurs. We've also mentioned as a complication is sperm antibodies, and this is more to do with the reversibility effect. And as I said, antibodies do form against the sperm approximately at 5 years. This, however, has no effect on your health whatsoever. It just affects the motility of the sperm. And lastly, there is a risk of about 1 in 2,000 that even though this vasectomy has been performed correctly, that the tubes could regrow. This is an international statistic, and we are fortunate in our organisation not to have had one of these episodes, but it's certainly worth knowing that it can occur, and it's important that you understand that as a potential complication to the procedure. All this information is provided in a booklet that will be given to you at the time of your consultation. It's also available on our website, and as I've always said to my patients, I'm available to answer any questions before or after the procedure. You'll also receive a pack, and in that pack will be a summary of what to do before the procedure, at the time of the procedure, and after the procedure. There's also a consent form that obviously needs to be signed before you do the procedure, and there's also a checklist of things that you must do before the procedure, like fasting, taking antibiotics, and being available for follow-up after the procedure. I hope this has been helpful for your information regarding this important operation.